to Youth Diary. Having a flawless skin is something not everyone is blessed with. Any change in climate or nutrition can affect our skin. Today we have Dr. Jeena Kuttan with us. She is a cosmetic dermatologist from Thrissur. Doctor, welcome to our show.
Thank you, Nita.
Doctor, can you just tell me what are the common problems that you come across in your clinic?
Among youngsters?
Yes, among youngsters.
Okay, I think the most commonest problem that youngsters come to my OPD with is pimples.
Okay.
Pimples and maybe dandruff. I think both coexist.
Okay.
Because people with pimples usually complain of dandruff also simultaneously.
Okay.
So among all the problems, the commonest will be pimples or acne.
Okay, right. So doctor, here are some video clippings. We can just have a look at that.
Hi ma'am, I am Rajin. I am studying MC in Ascengist. Actually I have a problem. I sweat a lot. Is there any medicine for recovering that?
Okay. He is complaining of sweating.
Sweating. Okay.
Yes, yeah.
Sweating. So
Yes.
sweating, he hasn't exactly mentioned what type. I mean,
Okay.
where is it? Is it a generalized sweating, or is it confined to his palms and soles, or is it in his axilla, I mean the underarms?
Okay.
Because excessive sweating, it's also called hyperhidrosis.
Okay.
It is a very common problem among youngsters. And I think the most common problem, the most common type of excessive sweating that youngsters complain of is underarm sweat.
Okay, right.
And of course associated malodor.
Okay, bad odor.
Bad odor
Bad odor.
associated with excessive sweating.
Okay.
And another thing, another type of sweating is something that's confined to the palms and the soles. And when it occurs on the palms, especially in youngsters, it causes problems during their exams. I mean, some students actually say that they can't even hold their pencils or pens properly. They keep on slipping off from their fingers. And when it occurs on the soles, it causes bad odor of their shoes.
Okay.
Whenever they remove shoes, it causes a bad smell.
Especially they have to wear socks also.
Yeah, especially, and most youths use nylon socks.
Okay, right, yeah.
Okay, so when there is treatment for hyperhidrosis or excessive sweating, the most common treatment involves use of lotions.
Okay.
Which usually contains a chemical called aluminum chlorohydrate.
Okay.
That can be available, it's available as over-the-counter preparation, or you can get it as a prescription medication.
Okay.
And I think that's the most practical thing. There are other treatments for hyperhidrosis like surgery or oral tablets.
Okay.
In extreme cases, you can take oral medications, but that's not advisable because...
So like before going to these surgeries, will you recommend this type of lotions or?
Yeah, I think that's the most practical. The thing is, it's only temporary. It's not a permanent cure.
Okay.
I mean, a person who can apply it in the morning after his or her bath and go to college, it will maybe last till afternoon or evening. The effect will
again,
last.
they may have to.
Yeah, they'll have to reapply it at after the evening bath also.
So, will there be any side effects for these lotions?
Usually no, but studies have found that it can cause blockage because these crystals of ammonium chloride can block the sweat pores. So theoretically it can, but in practice I don't think it really occurs. That's the most practical thing that a person can do.
Okay.
And another sweat which is normally produced from the sweat glands is odorless.
Okay.
Only when it gets secondarily infected with bacteria does it become foul smelling.
Okay.
So there are things that have to be done to prevent foul odor, and that is one, you should tell them to use only cotton clothes.
Okay.
Synthetic cloth can retain sweat on the skin, and thereby it can facilitate the growth of bacteria.
Okay.
Another thing is, bacteria grows when hair grows on that area. It grows, it multiplies in between the hair
follicles.
So underarm and pubic hair should be trimmed, always kept trimmed and clean.
Okay.
Because that also can facilitate growth of bacteria and secondary malodor.
So doctor, we'll move on to the next question.
My name is Sayuj Raghavan. I'm studying MCA in SNGS College. Nowadays we can see a general trend that youth are going for hair straightening and perming. My question is there any side effects regarding that?
He's asking about a hair treatment, I believe. Okay.
That is a trend nowadays among youngsters, you know, to go for straightening. Anybody who wants curly hair wants straight hair. Those who have straight hair want curly hair.
Okay.
But all these procedures in actuality involve extremes of heat and of course application of chemicals.
Okay.
And if done improperly,
Okay.
It can cause damage.
That means it is safe in proper hands.
Yeah, it's safe in proper hands.
Okay.
And another thing is how frequent you do it, because the main damage occurs to the shaft of the hair. So when excessive heat and chemicals are applied to the shaft of the hair, they become brittle. The shaft becomes brittle and it gets prone to breakage.
Okay.
If done improperly, another thing is that the heat may be applied directly to the scalp.
Okay.
And that in turn can cause damage to the roots of the hair and sometimes even permanent damage to the roots of the hair and permanent hair loss.
Okay.
So if it's done once in a while, it's okay. And if done by a trained professional, then also it does it. But don't do it, you know, very often.
Okay. So another question is that I have heard this straightening and I mean this kind of chemical treatment will lead to hair fall.
Hair fall, usually no. Hair breakage is more common.
It's more common. Yes. Okay. Okay, doctor. Let's see what our young friend has to say.
Hi,
Hello.
I am Soumya, doing MCA. Most of the females suffering facial hair, and how to solve this facial hair, and what is the side effect of that facial removing?
She has talked about the unwanted hair on the face. Yes.
Okay. Facial hair. First of all, if you have facial hair, what the girl should do is go to a doctor, because it can be a result of a hormonal problem.
Okay.
So the most common thing that causes facial hair nowadays is polycystic ovarian syndrome.
Okay.
And and there are also other conditions like adrenal disorders or pituitary disorders which can cause facial hair. So the underlying cause has to be found out.
Okay.
Because treatment of facial hair nowadays, you can do many things for facial hair. You can do temporary things like waxing or threading or using depilatory creams, but these are all only temporary.
Okay.
If you want a more permanent solution for your facial hair, you have to go to other procedures like electrolysis, and the trend nowadays is laser treatment.
Okay.
But laser treatment is costly. So before going on to any costly treatment, you have to first go and find out if there is any underlying cause, and that should be treated first. Another thing is that you have to ask whether she has any family history.
Okay.
Of, you know, whether
facial
her
hair.
mother or sisters or aunts have facial hair, because many cases may be hereditary.
Okay.
And the side effects regarding laser, other than the cost, of course, if you do it improperly, it can cause pigmentation, facial pigmentation. Hyperpigmentation, but usually it's not permanent. It's only transient. It will go off. Otherwise, there are no side effects for laser treatment.
Okay. This laser treatment, does it need only one sitting or?
No, that's also another thing. The minimum you should do it for 6 months continuously, consecutive 6 months. And sometimes another thing is that laser treatment does not result in hair removal, complete hair removal.
Okay.
It will only cause a reduction in the hair. So it's actually a laser removal is actually a misnomer. You should use the term laser hair reduction, because that's what usually happens. And especially in cases with an underlying hormonal problem, this 6 sittings may not be enough. They may have to, you know, continue further on.
Doctor, you said consecutively for 6 months. In the 6 months, like how often?
Once a month.
Once a month.
Usual treatment
Once a
is
month
once
for
in 4 to 6 weeks.
Okay. After that again, do we have to go to a cosmetologist and check for the hair reduction, or can we stop with that?
After 6 months.
Yeah, after 6 months.
After 6 months, you have to go and check.
Yeah, you have to consult
again. If the hair is coming up again, you may have to continue.
Doctor, we'll go on to the next question.
Hi ma'am.
Hello.
Good afternoon.
Good afternoon.
Ma'am, my name is Surya Supri. I'm an SH final year student and my specialization is electronics and communication. My age is 21. And you know what the girls, I mean the youths, they are when going in the noon session and all, when they reach now, we can see lots of pimples in our faces and all. So there are lots of medicines available in the market, high cost like that. When we go to doctors, they'll prescribe that. But most of them, for most of the students, there'll be some bad effects for that.
For the medicines?
Yeah, for the medicines.
Yeah.
So can you tell any other prescriptions and all, which will not affect our body?
Okay.
Like that.
She has asked about the pimples. Yes, yeah.
She's asked mainly about the treatments which how to reduce the side effects.
Side effects. Okay.
So doctors usually prescribe creams and gels, as well as creams and gels first for pimples, and then when those don't work, they change on to systemic treatment or oral treatment.
Okay.
And creams and gels usually involve a group of chemicals called retinoids.
Okay.
That is usually the standard treatment which is given for pimples, and if not applied properly, it can cause initial irritation.
Okay.
So there are several things which you should remember when applying a retinoid. One is that it should be applied only as a very thin layer.
Okay.
And even when it's applied as a thin layer, it will cause a certain amount of irritation. That's called retinoid dermatitis.
Okay.
But usually if you continue the cream for a few weeks, the dermatitis subsides on its own.
Okay.
But still, if it's very intolerable, another thing you can do is apply the cream as a short contact. That is mainly for 1 or 2 hours, and then wash it off at bedtime, or maybe even on alternate days for 1 or 2 hours.
Is it mainly applied at bedtime?
Yeah, it should be applied only at bedtime.
Okay.
I mean, the retinoids should be applied only at bedtime. And usually the skin gets accustomed to the irritation, and the irritation finally subsides. Another thing, whenever you use a retinoid on your face, you have to use a sunscreen in the daytime, because a retinoid can cause photosensitivity, or that means an increased sensitivity to sunlight. So it's a must that you should use a sunscreen in the daytime also.
Okay.
And there are other antibiotic creams and gels also which can be applied. Benzoyl peroxide, these are also another medicine. This is also another medicine which is given to apply topically for acne. And about the systemic treatment, that depends upon the type of acne.
Okay.
Sometimes if it's just a mild type of acne, the doctor may give a course of antibiotics.
Okay.
But sometimes if it's really severe, then also these retinoids can be given as capsule form.
Okay.
The only side effect of retinoids when given orally is that it should not be given to a female who is liable to become pregnant. So it's usually avoided in married females, because it can cause adverse effects to the fetus, that is the baby.
Okay.
And similarly with retinoids, when taken orally also, these also can cause photosensitivity or reaction to the sunlight. So when taking retinoids orally, you should use a sunscreen in the daytime.
Okay.
Another common side effect of retinoids is a dryness or cracking of the lips. So for that you can use just a simple lip balm or Vaseline.
Okay.
Otherwise, there are no side effects. The main thing is about about giving retinoids in childbearing females. That should not be.
Okay. This pimples can cause severe scars on the face. So how to overcome that, doctor?
Yeah. Scarring, that's the major problem with pimples, because pimples, it's a frequent question. Pimples will go off after a few years, so why should we treat pimples? The main thing is to prevent scarring. So for scarring, there are several things which can be done. One thing that commonly youngsters do is, break the pimples, squeeze pimples with their fingers.
They have tendency to break
they have a tendency to spend hours in front of the mirror squeezing their pimples. That will invariably result in scarring. So you should never bring your fingers to your face. Okay. And there are treatment modalities for scarring. There are several procedures like chemical peels, dermabrasion, microdermabrasion, and resurfacing lasers like erbium glass or erbium YAG or carbon dioxide lasers. These are all treatment modalities. And you can do simple surgical treatments also. There are different types of surgical procedures. Derma roller treatment, that's another thing which can be done for. There are several treatment options for acne scars.
So it all has to be decided by
Yeah, you have to go and see a qualified dermatologist and decide. and it takes time also.
Oh,
It takes a course of several months.
Doctor, we will go on to the next question.
Hi ma'am, I'm Ramya. I'm doing my BTech. I'm final year student, but I'm 22 years old now. So today youth is very much concerned about their health on skin, hair and all.
Yeah.
So I would like to know about various treatments for dandruff. Is there any relation with our daily food habits? That is, we must include more fiber content food. What all are the precautions we must take to prevent dandruff?
I think this is one of the commonest problems that almost everybody is facing.
Dandruff, it's very common. Dandruff actually involves two processes. One is there will be an increased production of the cells. There's an increased rate of production of the cells of the scalp for some reason. That's because of an inherent nature of the person. And secondly, on top of this, there is an overgrowth of a fungus called Pityrosporum ovale. And it's the combination of these two mechanisms that causes the flaking and the itching associated with dandruff. But another thing is that dandruff may not, it's usually due to something called seborrheic dermatitis. But other skin conditions can also cause dandruff, like atopic dermatitis or psoriasis. These are all things that cause a similar clinical picture to seborrheic dermatitis. Seborrheic dermatitis is the most common cause. So the first thing, you should go and see a doctor to determine what the cause of your dandruff is. And if it is seborrheic dermatitis, like I said, you should use a medicine that addresses both of the problems, that is the increased production of the cells as well as the fungus. So ideally you should use a shampoo which contains coal tar. Coal tar is a medicine which controls the increased overproliferation of the skin cells. And or salicylic acid. This also controls the overproduction of the skin cells. And along with that, the shampoo must also include an antifungal, which may be ketoconazole, selenium sulfide, zinc pyrithione, cyclopyrox. These are all antifungals. Another thing is that usually what patients say is that, doctor, I shampoo ubechu, oru maasam ubechittum dandruff poyilla. That will never happen. Dandruff can only be controlled. It cannot be totally eradicated. There is no cure for dandruff. Just like a person needs to continue medicines for diabetes or hypertension, the shampoo for dandruff should be used at least twice a week continuously, because you can only keep it under control. That's a common mistake that youngsters make when taking treatment for dandruff.
Doctor, we have a mail. I'm a 19-year-old engineering student. When I go to college, I usually don't get enough time to change my napkins, so that it causes itching at my genital area. So what should I do?
That's a very common problem, because use of sanitary pads, especially the ones nowadays, the ones with wings. These when used for prolonged periods from morning to evening, and along with the humidity, especially in our climate, the increased humidity and the heat, it leads to a secondary fungal infection of the area. So the best thing for this is prevention. Always prevention is better than cure. So find time to change your sanitary napkin in between. At least it should be changed at least 2 to 3 times per day, depending, and even more depending on your flow. So that's the best thing. That's the only thing you can do for this. Change your napkin, and if possible, avoid using the types with wings. That's the best thing.
So personal hygiene is the best remedy for this. So doctor, this was really an informative talk. Thank you so much.
Thank you, Meeta.
If you have any suggestions or doubts, please write to us. Our email ID is youthdiaryroseball@gmail.com. See you next week. Till then, it's me, Nita Ghosh, signing off.